Good afternoon, everybody. This is Gary Pace. I'm the Lake County Public Health Officer. It's Monday, December 28th, 2020, and this is the coronavirus update for Lake County. I'm going to go ahead and put the graphs up today to show you that. So here is the epi briefing for December 28th. The first graph shows the total tests in California. This is the graph on the left-hand side, continuing to increase the number of tests that we're doing in California. The number on the right side is the positivity rate in California. And this is the number of positive tests that are being found. So even though we're increasing the number of tests, you can see that the curve is starting to flatten down a little bit. So this is good news. This means that most likely what's happening is the Thanksgiving surge is starting to decrease now, and we're starting to see some improvement, and also that some of the stay-at-home orders that are in place around the state are actually starting to have some effect. The problem is that we just came out of the Christmas weekend, and so most likely with all of the travel and socializing that everybody did over the Christmas holidays, we're going to see this going up again in the next couple of weeks. But at least we can see now that after Thanksgiving, things did start improving, and it looks like the stay-at-home orders did start having some positive effect. The next graph here, this is still all of California. On the graph on the left-hand side is the total number of cases, new cases, and this usually lags a little behind the test positivity rate, but you can see that it is starting to flatten down a little bit as well. So this is all indication that we were starting to see a very early flattening out and potentially dropping of the number of cases. But again, with the Christmas holidays being last week, it's probably going to continue going back up again. The middle graph here is the hospitalization rate in California, and this usually lags about a week or two behind the positive case rate. So it is still on the upward swing. And this is really important because of the concerns about running out of hospital beds around the state. Now, this one on the far right is the Icu Bed Availability, and you can see that earlier in the year, in the summertime, it was running about 4,000 beds available, and now we're dropped down to about 1,500. And in some parts of the state now, there are actually no ICU beds available on most days. This last graph here is the total death rate in California. We had 237 new deaths yesterday, and this is continuing to rise. This, of course, lags a bit behind the hospitalization. So we would expect to see this continuing to rise for another week or two because of the earlier increased cases and hospitalization. This shows the 5 different regions around the state: the Bay Area, Greater Sacramento, San Joaquin, and Southern California. All of these 4 are in a what they're calling a stay-at-home order, which is not allowing outdoor dining, basically not permitting any kind of outdoor gatherings, and certainly no indoor gatherings. It's pretty much like where we were back in April or May. Northern California, the region we're in, is not in that order at this point. We do have about 25% ICU availability in the northern region. The rest of the state has under 15%. Southern California and the Central Valley have something, under 5%. The Bay Area is in around 10% right now. This is a little bit of a complicated slide, but it's actually really helpful to see that Lake County is the purple line here, and we were running pretty good up until early November, started rising, and then over the last couple of weeks, we've stayed about the same. The case rate is now 41 per 100,000, which is the highest we've ever been. But you can see in the blue here, that's California. They're much higher, upwards around 100 or so per 100,000. The Rancho, which is the red line, actually dropped some after Thanksgiving, but we're staying about the same at this point. This is the testing positivity rate. We've talked about this already. It's pretty similar. This is the Lake County, what we call in the epi curve, which shows along the bottom is the dates, and on the right is the number of new cases. So you can see we've been on this pretty significant steep curve upwards. We don't know how high it's going to go, but these two gray ones that we're still getting test results in from those weeks, and so they're expected to be higher. So it looks like it's continuing to rise at this point. We do have over 300 active cases at this point as of this morning, and we've never had that before. So that means there's 300 people that we're aware of that are infected and contagious at this point. That's the highest ever. And again, we expect it to continue increasing. So this is the last curve I'm going to show. This is a little bit complicated, but it's a good one to look at because it gives us some idea about hospital capacity and ICU beds. So around the state, the ICU beds are filling up. In Southern California, there's actually a really good article in the LA Times this morning. If people have access to that, it describes some about what's going on down in Los Angeles, and it also describes about why they're having such problems down there right now. It seems to be that the housing density and also kind of having a low number of hospital beds anyhow has led to a little bit of a critical situation right now. But this is the graph that shows our local ICU bed capacity, and these gray lines are show how full the ICUs are. We only have 8 beds normally in the county. So this line here is the number of 8. So when it gets to that, we're at full capacity. And you can see that most of the time over the last couple months, we've been pretty much full or at 7 or 8 beds, never below 6 really for the last couple months. So we're always between 0 and 25% capacity, even on a good time. And now with things worsening, it's going to be worse. We send a lot of our people out of the county. Up to this point, we've had essentially 100 hospitalizations in the county for COVID, and 50 of those have been transferred out of the county to other regional hospitals. The 2/3 of those hospitalizations out of county have been down in the Bay Area, either Napa, Sonoma, or down in San Francisco. 20% or so have been over in Mendocino County, over in Ukiah, and the rest are a smattering of other places. But this red line here is the number of COVID positive people in the ICU in Lake County. So the gray lines are the number of ICU beds that are filled, and then the red line shows the number of ICU beds that are filled with COVID positive patients. And you can see that number is increasing here. And again, we have transferred almost 100 people out of county that had COVID positive to other hospitals. So this is really important in terms of our bed capacity, because we just, most of the time we run pretty full here anyhow and transfer people out of county. Now with COVID and the increasing number of cases, the increasing number of hospitalizations, we're going to be seeing increased pressure to get people out of the area to the regional beds, and they may or may not be available. So it's a little bit of a tight situation we might find ourselves in the coming weeks. So this is just a way of illustrating that. We talked about the numbers: 1,791 total cases, 306 are active, 23 people have passed away, and 12 are currently in the hospital. We have an 11.5% test positivity rate, and the case rate is about 30 per 100,000, something like that today. And the ICU capacity, we went over that quite a bit today. So the cases are really showing up all over the county, and with 300 active cases, that's a lot. And we're getting calls from different businesses and different kind of settings that are worried about what their situation is and how to manage with the positive employees or with people who have had contact. We have had this tribal outbreak that's been going on. That seems to be slowing down now, but there's been a total of over 100 cases out at that site. And we have been working hard with the tribes to try to contain that. And I think it looks like it's starting to slow down now. And so that's good news. We have 3 nursing homes in the county. 2 of them have some positive cases, but they're pretty well managed at this point. And the nursing homes are doing a really good job of trying to contain this as best they can. They've gotten their procedures down really well now. It seems to be going well. The schools are closed now, of course, but they were starting to get a bunch of cases before they closed. And we are seeing just a lot of the businesses showing up with positive cases. We're getting reports of small businesses, big businesses. And, one of the things that's important to communicate is we do have a protocol. When we hear that there's a case out at a business, we contact them, and we've been sort of talking with them about disinfection and about contact tracing and about how to manage this to try to protect the public. Our number one goal is to protect the health of the public and to decrease the spread out in the community. And so that's really what we've been doing. And every business, we kind of go through the same process where when we are informed that that person works at a certain place, we'll contact the business and help them kind of walk through this. We have been with certain businesses, usually food establishments, where it's been identified that one of the employees tested positive and worked within the last 24 hours. We've generally been following the CDC guidelines, which is closing down the business for 24 hours, helping them do the disinfection, helping them get the contact tracing together before they open back up, where they kind of have everything in place. They're sure that the staff are not the ones that were in close contact and they've done the disinfection. If the person who tests positive hasn't been to work for a while, it doesn't really make sense to close the business down as long as the contact tracing is going okay. So we've been kind of going through this with all the different businesses. We have made a decision recently that we're going to just start changing that. It doesn't really seem like, with so many cases and so many businesses being impacted, we now have kind of the newer information is that it seems to be less likely to spread with direct contact. So we are going to try not to close down businesses anymore for the 24-hour disinfection period, but more to just work directly with them about how they can disinfect and do the contact tracing maybe at night or something like that, so that we don't have to be asking all these businesses to shut down. I do want to emphasize that the business community has been very responsive overall. It seems really clear that they have the interests of keeping the community safe and getting open and keeping going as best they can. And so it's been a good experience for us to be working with everybody, and we want to try to kind of pull away that 24-hour closure, because it just doesn't seem to have been as effective, and it seems like it's probably more useful to focus on the contact tracing and other things like that. So moving forward, we want to keep working with the business. We want to keep working with everybody, but we're most likely not going to ask them to close down unless it's a special situation. So in terms of the response in the community, we are continuing to try to work on our communication. It's been hard over the holidays because there's not been that much staff around, but we are connecting now with Hope Rising, and they are going to be doing some messaging through social media and through other outlets. We have these 2 RFPs that should be up in front of the board on next Tuesday, where we're trying to specifically address the needs in the Native American community and the Latino community. We are putting out press releases at least once a week, if not twice. We're doing these kind of videos also I'm up in front of the Board of Supervisors next week to give an update. So the weeks when I'm not in front of the Board of Supervisors, we'll be doing this video with the help of Sam, and I really appreciate the help. It's a lot better than my selfies on YouTube, and we're just trying to get the word out as best we can. So the testing sites are changing. There's a lot going on with the testing. The state contract has changed, and so the Verily test site will be ending by Wednesday afternoon. So this week is a holiday week. We are going to be open Monday, Tuesday, and Wednesday this week in Lakeport at the health department from 9 to 2. And then we'll be closed Thursday and Friday. And then starting next week, we're going to be opening with a completely different site. So let me finish with the Verily site. We're going to be open Monday, Tuesday, Wednesday this week from 9 to 2 at the health department. And you go through the normal ways of getting your appointment, going onto the website or calling our phone line at the health department. Thursday, Friday, we're closed because of problems with the state lab and the holidays. And then starting next Monday, we are going to be having the OptumServe site started. So this is going to be a different setup. It's not going to be a drive-through. It's going to be a stand-up indoor testing site. On Monday, Friday, and Saturday. It's going to be in Lakeport at the Lakeport Community Center. It's going to run from 7 in the morning till 7 at night. So you'll have 12 hours now that you can go in and get it. It will be, kids can get tested as well as adults now. And you can make appointments either by going on the OptumServe website and making an appointment online, or calling the phone number that's listed there, or you can just walk in without an appointment at all, and we can serve you then. So this is not the county doing this. This is a separate standalone thing through OptumServe, but it's to make sure that we have enough testing in the community. So that's going to be Monday, Friday, and Saturday. Tuesday, Wednesday, Thursday, we're going to have the same setup at Lower Lake, at the Lower Lake Town Hall. It'll be 7 to 7. You can walk in, you can call, you can make an online appointment. Kids can get tested, and you don't have to have insurance for any of these sites. So this is going to be what we do ongoing now, is have these, we're going to try to have these 2 sites going indoors where you have to walk in and get tested, and then you get your results back through a text or an email. Rite Aid in Clear Lake is doing drive-through testing, and you can get that for tomorrow. That's partly why we moved the site to Lakeport this week, because the Rite Aid testing was available. So if you are in Clear Lake and you need testing this week or any week, you can go through the Rite Aid website, or they call it Project Baseline website, and you can get an appointment there just like you did with our old Verily site. So moving forward, this is the way the testing is going to be done. And if you're having problems accessing it, please let us know. Please give us feedback on whether it's working or not. But I think it's going to give a lot more access to people in the county. The hours are going to be better. And given the bad weather, it's probably going to be better to have it indoors. So contact tracing, with so many cases, we now have over 300 active cases, and we just simply don't have the staff to track that down. And also, people have been not particularly interested in cooperating with the health department anymore. I think people have the information that they need, and then if they're choosing to follow it, that's great. If they're choosing not to follow it, then they just sort of tend to try to ignore our calls and our advice. So we are now continuing to call, make sure people have gotten a positive, that they know that they're positive, and we'll send them information by email, or we'll direct them to the website where they can get the information about isolation and quarantine. They can also send in information on there's a survey that comes out about the contacts that they've had, so that we can sort of try to help support all that. But it's really getting to be more of a kind of a self-serve sort of process, where you need to be isolating and quarantining. If you're positive, you need to be contacted the people you've been in contact with and let them know that you're positive. You need to let your boss know, and so that we're just not able to be tracking everybody down now. It's we are trying to put most of our efforts now into getting the vaccines going, because it seems like that's where we're going to get the best luck. Clearly, there's been a lot of reluctance to involve with a lot of these ways of protecting ourselves and ways of protecting our families. And so we're still giving the information out, but we're not going to be tracking everybody down quite so hard as we have been before. The enforcement part, we did talk about the businesses, and that we're not going to be shutting down the businesses now. Cal OSHA, so the Occupational Safety and Health Association, has gotten more involved with COVID protections for the workers. And so if a worker's out there and they feel like their workplace is not taking the proper steps to keep the workers or the public safe, they should contact Cal OSHA. They seem to be having more interest in getting involved with this. And there's also a new requirement that started on December 1st, that if a business has 3 cases or more in it within a 14-day period, they need to inform the health department, and will let the state know, because that's considered an outbreak, and it's kind of in the public interest for everybody to know that. So that's a new Cal OSHA requirement. We are still working on trying to hire the enforcement officers that would go out and talk to businesses about safety issues, and if there was non-compliance, eventually to go to a small fine to help bring about compliance, but we do not have that person hired at this point. So the vaccines, this is a big deal, and this is probably going to be our way out of this situation with COVID and all the restrictions that are involved with that. We've gotten a little over 1,000 in the county at this point. We've got 300 people that have been vaccinated, probably more by now, but by this morning it was about 300 mainly at the 2 hospitals and some of the nursing homes. So we're really trying to focus on getting this out to the people at the highest priority. And the state has given out some pretty clear guidelines about priorities. And the idea is that because of all the risks to the hospitals and the nursing homes right now and the problems with just keeping all these places open and taking care of people, we're trying to focus on them. So the workers in the hospital are the first priority. Workers in the nursing home are in this first priority tier. The medical EMS workers, so the ambulance drivers and the first responders from a medical point of view, and people in the dialysis centers. Those 4 are the ones we're really focusing on and trying to make sure we get them covered. The tricky thing is we're getting a certain amount of vaccine in, and it's coming from other places too, but nobody seems to know when. The state's not communicating how much we're going to get. Each week we try to order more. Sometimes we get it, sometimes we don't. And then the hospitals are supposed to be getting it from their corporate structure, but they don't seem to be communicating very well with the state and the corporate structure. So I believe one of the hospitals may have gotten a few vaccines by now, but the other one I don't think has gotten them yet. So we're working with both of them to try to get people vaccinated as fast as they're interested in getting vaccinated. And then once they start getting the vaccine in from their corporate level, then we'll back off and redirect it to other places. It's the same with the nursing homes. So 2 of the nursing homes have an agreement with CVS, and they're supposed to be getting vaccine in from CVS. CVS will send some workers out to the nursing home to vaccinate staff and residents. But we just got word a couple of days ago that that's not really going to be till the middle of January now. And we really want the workers for sure vaccinated before that so that they're safe and not getting sick. And so we're going out there and starting to do the workers that want to get vaccinated as soon as we can. Then when it comes in through CVS and Walgreens is the other place where it's going to be coming, then we'll back off and let them finish up, and then we'll go other places. The EMS guys, the EMS staff, mostly guys, but not all guys, there's a clinic today that some of them are getting vaccinated. A repeat one on Wednesday where some more are getting vaccinated. So these folks were all just really making a big push and putting all our effort into trying to get everybody vaccinated in this tier that it wants to be. Then the next tier is going to be probably starting next week. And once we get this one sort of coordinated, we'll be moving on to next week. And we'll probably have at least 1 or 2 stand-up clinics for outpatient clinic workers, for IHSS workers that are working with people outside of their homes. So there's a sort of 2 different types of IHSS workers. There's the ones that work with their family and they're already in the home, and we won't prioritize those people. The people we really need to get vaccinated are the ones that are taking care of different people in different homes, and they might be spreading around the infection to different vulnerable people. So those folks we want to try to get vaccinated next week or the week after. And then jail medical staff and some other medical staff and some of the other congregate living facilities we're going to focus on. Then after that, we get those folks, and this will probably be sort of by towards the end of January, then we could start focusing on the other medical practices, the dentists and the labs and the optometrists and all those kind of folks. So it's probably the congregate living situations, and those are people that will be the next tier. So those are all the first grouping that we're going to be focusing on. And we're getting a lot of people interested in when they're, the people that are working for them are going to be able to get vaccinated. And probably if the vaccine keeps flowing the way it is now, then we'll be able to do that pretty soon. The state is working on some specific guidelines around all this. They're working on who's who's going to be next in this next grouping. And the next grouping is going to include like essential workers, people over 74, and people with chronic medical illness. And they're hard at work on making this list and the like clear guidelines about how to move through. I think what's going to happen is the essential worker group is going to be first. And that's going to include law enforcement. It's going to include teachers, and it's going to include food service workers and farm workers and other people that really have to keep going to work, even though they're out in public and it's putting them at risk. We're still waiting to see exactly how the state's gonna flesh that out, and then we'll just follow what their guidance is with that. So people can look on the website, they can look on the state sites about the guidance, but right now the first grouping is this one with the medical people and the different steps that I outlined, and then the second grouping is going to be this essential worker, people over 74, and the chronic people with chronic medical conditions. So we'll just have to keep kind of having this discussion and sort of figuring out where some people fit that didn't get in that list. And but we're really trying to support the medical community right now because we need them to keep everybody safe during this big outbreak. I think, a couple things I also want to say about the vaccine is one is that the safety concerns, a lot of people seem to be concerned about getting the vaccine early on. And I just want to reassure you that we've had really good luck so far with the 300 people we've done, and that's been the experience around the state and around the country. There's been a few cases of kind of severe allergic reactions. As far as I know, all those people were people that have a bad history of an allergic reaction, and they should bring their EpiPen with them when they go get the shot and let them know that this is something that they've had a problem with. But I think at this point, the risk of the vaccine is for vast majority of people is far lower than the risk of getting COVID. And so I think it's really important for people when they are able to get it to go for it. The sooner we get more people vaccinated, the better, the sooner we're going to get back to a more normal lifestyle. Dr. Fauci now is saying that we might need to get as many as 85% of the population vaccinated before we're going to be pretty comfortable going back to normal activity. So I think it's going to be really important for people to go ahead and get the vaccine as soon as they can. And since we're not sure of how the supply is going to go, I would say if your group comes available to do it, go get it as soon as you can, because the consistency of the supply chain is going to be a little bit in question sometimes. So, and the other thing is both these vaccines, you need to get revaccinated 3 to 4 weeks later. And we're going to have to be coordinating that and making sure that works out. So the safety side effects are good, have been very good. We did do a little video that's on our website that Dr. Sharon did that was sort of discussing some of the specific safety concerns and side effects. We also have not seen much problem at all with people not being able to work after this first shot. So the first shot, there might be a little bit of a sore arm, a little bit of a headache, but it's really not much at all. And there's been nobody that I'm aware of that hasn't been able to work the days afterwards. The second shot may be a little bit more problematic. There's some suggestions that may be more of a side effect situation where people may need to take a day off from work. We're not sure yet, but we haven't really been seeing that so far with this first dose. So, I think overall we are, doing pretty good. The vaccines are getting out there now. We want to be really encouraging people to get vaccinated as soon as they can, because I think that's going to be how we best get out of this situation. It's going to be a difficult couple months. I don't think there's any doubt about that. I think the hospitals filling up is something that we're watching really closely. We're watching what's happening in Southern California. We're watching what's happening around the region. I think if people need to go to the hospital for whatever reason, if you're having chest pain or you're sick for some way, it's really important to go to the hospital, go to the doctor and get the care you need. If you're not in that situation, it's something that can wait the next day and you can go see your your regular provider at the clinic, that's probably better at this point. We're trying to keep people out of the emergency room. They don't need to be there because there's just so much demand in other ways. But if you need to get some medical help, go get it. Don't wait. And we are definitely aware of the need for people to continue getting their regular medical care. And so please don't make bad decisions like that. I think, the holidays will probably lead to a surge more than we've been seeing already. I think the more people can stay home, the better. We really, really want to encourage people to stay home as much as possible. Work from home if you can. If you're going, if you need to go to the store, it's know that if you're going into a big store with a lot of people in there, there's risk involved with there. Almost for sure now, with the higher level of virus out in the community, you are going to be bumping into people that are positive. And so if you were able to do things back in October and you feel like, well, I can do, it's been fine so far. It's a different lay of the land. It's a different landscape right now. I think it's probably much better to not go to crowded stores, go at off hours, especially if you're in a vulnerable group, wear your masks. It's being in a crowded store right now is a bad idea. And it's probably going to be this way for another month or two. And then hopefully we're going to be in a new phase where enough people are getting vaccinated and we can be outdoors a little more and it'll be a lot better. So overall, I just want to wish everybody a happy new year. We all are very aware of how hard this year has been, and it's been hard on us too. And it's been kind of a tough holiday season where you can't see family and friends and everything. So we do the best we can. I think we're kind of in the midst of the hardest part right now, and it's going to go on a bit longer. And then I'm really hopeful that we're going to be able to get out of this and move into a new phase. So thank you and have a happy New Year's.